Okay, let's take it away. Let's see who's joining along the way. Um, so let me start introducing myself a little bit, and then I'm very pleased to give you the floor to introduce yourself a little bit more. I think it's better to maybe change the order of the presentation. I was planning to talk a little bit more about design thinking up first, and then introduce you. Maybe if we start with the introductions, and then maybe some other people will join. We have some more people about the basics to go through design thinking before getting into the discussion. So my name is TIMO. I am working with the Infectious Disease Institute. I have a business, some businesses. I'm trying to push boundaries and love change. I have a master in public health and I have an MBA. And I've been working a lot in the field of management consultancy, resource mobilization, distribution of medication, primarily in the East African context. And most of my career has been taking place in Uganda. Currently, I'm in Belgium, but I'm based in France. And I'm very pleased to facilitate this meeting today. Yeah, so I maybe love to give Abigail maybe the floor to introduce herself.
Yes, hi everybody. My name is Abigail Turinayo, Hamwada as well. I forgot to include that for you, Timothy. I am a designer, an architect by training, and I say that, you know, I am embracing discomfort because a lot of the kind of work that I've been involved in, I guess I could say that, you know, if I'm not courageous about, you know, taking chances and, you know, embracing the discomfort, you know, a lot of innovation really stems from just going for it. So I sort of take that up as part of my motto in life. Architecture and urban ecological planning are really my background and training. I currently serve as the head of design at Design Without Borders. Yeah, it's an organization that is based both here in Uganda, and we also have an office based in Norway, in Oslo. I've been serving with that organization for over the past about eight or so years, doing a lot of product, service development, industrial design, and maybe a bit more the last maybe about 6 or 7 years, specifically in Uganda, we've had quite a bit of a focus on design in healthcare, you know, global health, addressing various challenges within this particular field. So I'm really happy to be here, happy to be able to share a bit about the work that we're doing, some of the challenges. And yeah, I think also another thing to say is maybe also from the work that we do and the work that I've been a part of, we're sort of beginning to see how the design process is sort of evolving more and more every day, and sort of seeing how various other approaches, you know, such as like from behavior economics or implementation science or some of these other social anthropological disciplines can actually also complement design specifically in healthcare. So yeah, just a bit about some of the things that I'm really passionate about and learning and growing more and more and getting a lot more people, you know, within the different sectors to appreciate and see the role of design in actually creating a lot of impact, meaningful solutions, you know, and innovating, you know, not just getting used to the status quo, but, you know, thinking through how a lot of things can change for the better and for improved livelihoods for everyone, especially living in contexts like ours. Forgive me. Yeah, I think I'll stop there.
Well, thank you very much for that. Very insightful. Nuria, can I give you the floor to give a little bit more background about yourself?
Okay, thank you so much, Timo. And greetings to you all. My name is Nambo Gonorrhea. I work with CAMTech. CAMTech is the Consortium for Affordable Medical Technologies. It's an innovation hub based at Mbarara University of Science and Technology. we do mentor innovators all through from ideation up to when we see the product out there. So I'm the research and grants manager for Camtech, but also as well as coordinating the hub activities. I'm an innovator myself. I've come up with a number of products and projects, innovation projects, but mainly I do mentor innovators, especially from when they are trying to understand their ideas, defining the idea, and making sure that what you're working on makes sense and the solution you're providing is a solution that would fit. I also sit on the committee for NISIP. NISIP is the National ICT Initiative Support Program, which supports innovators. It's under the Ministry of ICT and National Guidance, and I'm on the selection board. So I've mentored a number of innovators. My training is, I have a master's degree in management science, but I've worked more with innovators and on projects that are health related. I'm happy to be here to speak about design thinking. Thank you.
Thank you, Nariat. And then last but not least, Joanita.
Hi, thanks, Timo. My name is Joanita, and I'm a public health practitioner. I have a master's in public health, and in training, I work in technology. I lead administration at Refactory, a program that's based within Clark International University. We train tech talent. So our first focus was on practical and especially technical skilling of software developers to make sure that we have well-trained people, well-skilled people to serve the market, this region in this fourth industrial revolution, to be able to create products. But we've had to extend our training beyond the technical because it turned out that students weren't simply missing technical skills when they came out of school. So we've had to expand our curriculum at Refactory to cover non-technical skilling, things like personal development and leadership, methodologies of working in technology, like agile methodologies, lean startup kind of things, community engagement, and especially human-centered design as a problem-solving technique. So my work at Refactory really revolves around getting the right students into our programs and facilitating and sometimes co-facilitating the human-centered design modules. Yes, that's what I do at Refactory. And in my other life, I work with innovators to create sustainable products. Currently, I've been working on a project for about 4 years now. 2018, yeah, would make it about 4 years now. DrugDash, we built a web and mobile system that's deployed in 42 public health centers right now in the country in 5 districts. That's Bukedia, Bulambuli, Kwen, Kotido, and Kitgum, to help store managers be able to manage their stock and especially be accountable to their district health officers so that medicines can be redistributed to places where there's less and where there's need, and taken away from places where there's plenty so that districts do not sit with medicines and have to report expiries, while other health centers within their very, district do not have what other health centers have in plenty. So that's what I do for most of, my day work.
Great, thank you very much. So more people joined, fortunately. So I think it's great if we can go a little bit into design thinking. I plan to give like a small brief about design thinking just to set the framework. And I think we can learn a lot more from Abigail and Joanita in terms of are we still together with Nuriat as well? I guess so. And then we can learn more from your experiences in the field on how actually design thinking can be deployed to get actually great outputs that you otherwise would not have had. So let me quickly run through this presentation. So design thinking started quite some time ago, and one of the founders or one of the starters of design thinking was Tim Brown from IDEO, and he defines design thinking as a human collaborative approach to problem solving. It is creative, iterative, and practical. It makes use of designer tools to integrate user needs, technology opportunities, and constraints to commercial success. I think this is really what is capturing it, and I think it's a new approach of looking at things. So during design thinking, you use a couple of steps in there, and these are the steps that are part of design thinking. So you have a period of emphasizing. So you have a problem, you have to think about it, and you have to emphasize on that specific problem, whether it's the user, whether it's the one who's going to buy a product. You have to emphasize with the person that is going to be targeted. Then you have to define the problem exactly. You have to ideate around it together in a team, and then you have to prototype it. Make something that actually represents that what you are thinking of, and ultimately it leads to a phase where you're testing that what you came up with to just see how the user is going to respond to it. It looks a little bit like this. So there's a lot of chaos. There's a lot of post-its. People are standing up. People are moving around. You are sharing. No idea is a bad idea. Just trying to put as many things on the table as possible. And through the process, you're like scaling things down and you come up with a solution that you think is going to be applicable. So it works really on 3 areas. So you're trying to make things for people workable. So it's desirable for people. You're looking at the technology. Is it actually feasible for us to put this kind of products into the market? Or also we can look at business, and is it a viable business? Can it actually be a success commercially as well? And if you work with those 3 aspects, like in the niche area in the middle, that's where you're trying to work on, and that's where you're trying to explore and experiment with design thinking. So I think what we want to discuss today is, does design thinking provide opportunities to fulfill the need for patients and users in current health system? And I don't know if we want to dive immediately into this question, or if Jonita, Abigail, and Nuria maybe want to take the stage to tell a little bit more about their experience in using design thinking in real life, and specifically on health topics, if possible. Nuria, you were unmuted. Do you want to take the floor first?
Okay, no problem. Thank you so much, Timo, for that introduction. I think now people, like you mentioned, design thinking is a new way of coming up with solutions that are people-centered. So for like me who is from an innovation hub, that is something that we have tried to push forward as we engage with innovators and mentor them through the process of developing their ideas up to when we see them out there. So the question is, does design thinking provide opportunities to fulfill the need for patients and users in current health care systems? Of course, yes, it does, because when you use design thinking, you're putting the user at the center. We've had before, we had cases here at Camtech where innovators would come. Usually they come to me because I handle the first stages of ideation and trying to help them understand the problem, defining the problem especially. So they would come and they're telling you, you sit down with them and they're excited to talk to you about their solution. So when you ask them about the problem the solution is trying to solve, they were not able, most of them are not able to tell you the problem. Or when they try, they try to pull the solution to fit the problem, which does not work. So I think it's always good to make sure that as you're developing your solution, put the user at the center, consult them, and make sure that whatever you're developing, you're not developing it for yourself. You're developing it for the end user. And that's the way the healthcare system can get solutions that will be helpful. I'll give an example. I think we are getting some background noise. I'll give an example of one of the solutions that we have developed here for one of the innovators, whereby they were developing an innovation that would help monitor temperatures in neonates that are admitted at neonatal wards of hospitals. So they had to engage with the nurses at the neonatal ward at Mbara Regional Referral Hospital before they even started writing or defining the problem. So they had to engage them, ask them, gather as much information as possible about about the problem of monitoring temperatures for neonates. Because sometimes it's high, sometimes it's low, but you can't tell because the baby will not tell you what the problem is. So you will have to figure it out yourself, and you cannot look at them and think maybe the temperatures are high or the temperatures are low. And yet they are the highest killers of these neonates, especially when they are admitted because it's a silent killer. So we asked them to go and engage the nurses at ward. They gathered enough information that they use now to come back and define, which is the second step. So when they defined this problem, they gathered also literature. They were able to gather literature that helped them define the problem before they jumped into the solutions then. The solution they wanted to provide, solve the problem. So I think design thinking is something that we have if we need to come up with solutions that will be helpful in the health sector. Yeah, I think I can stop there for now. But as Camtech, we have developed steps through which these innovators are taken. And these steps put into consideration the design thinking or the user. So right from when you get into the hub, when you come up with an idea or you want to come up with a solution, we take you through the steps, and there are checks and balances in there. We invite stakeholders like reviewers to look at, for example, if it's written, it has to be reviewed and you have to pass that step before we can move you to the next step. If you fail, you go back. So for design thinking, it's iterative, and like sometimes it's hard to tell how long a project will take to move on to the next level or to be fully deployed for use. Yeah, I think for now I can stop there, and I allow my colleagues to also say something.
Thank you very much. Abigail, Jonita, does any of you want to add?
Okay, I'll submit next. Does design thinking provide opportunities to fulfill the need for patients and users in current health systems? I think the answer, or even the obvious answer to this question is yes, because design thinking literally is a problem-solving methodology that centers users. So if there's any way to fix the challenges of the health systems, of current health systems, in order to serve patients and other users or clients better, it would be design thinking, definitely. And I think for me, as an example of something like this, I will share an experience on Drug Dash. We started developing that tool in 2018 in January. And our case study, we were working with UNFPA at the time. They are eager to track family planning supplies And one of the more compliant districts then was Bukedia. So it was an easy, low-hanging fruit to start our needs assessment with. At the time, version 1 of Drug Dash was, we quickly understood that we had to create a mobile end of the.
I think we're losing Joanita here. Unfortunately, she just started telling us about this wonderful case study. Maybe I can ask you, Abigail, to maybe take over until we wait till Joanita comes back.
All right. Sorry for that, Joanita. I hope you can come back soon. Yeah, so I completely agree with both Nuriat and Joanita that absolutely design thinking is really truly about fulfilling the needs of users, and specifically within healthcare systems, patients, and how they navigate the healthcare system to actually be able to get the treatment that they need, to get the help that they need. It's really, really critical that we actually understand their needs, and design thinking does provide an approach to thinking about it very systematically, provides various tools to use to actually be empathetic. So maybe one of the things, even from the slides that you were sharing, TIMO, it's important to also mention that, the mindset that you go in when you're actually using design thinking is really critical in actually trying to put yourself in the shoes of the users, the people who are actually going to be experiencing and utilizing that solution that you're trying to come up with, and engaging them throughout the process is really, I think, part of the reason why design thinking really is able to, at the end of the day, fulfill the needs of the users, because at the heart of it is you're really seeking to empathize, seeking to understand their pains, seeking to really assess their entire, interaction with a challenge in particular that you're looking to address, and trying to really think through the details of how, how can we actually, create a solution that would meet their needs. And I think also one of the valuable things about design thinking is that it also says, that the experts are not you, the person who's trying to develop the solution. You don't come at it from a point that I'm the expert, I know everything kind of thing, but on the contrary, you're sort of coming into a community, you're coming towards a solution, towards a problem, and realizing that the people who are faced with it are in the best position to actually be able to see where could certain interventions come in, what would actually be applicable to us. They are really best suited, and removing them from that solution finding process is absolutely wrong, because you're sort of removing the people who would know best from that process, which is what design thinking is about, is, who is affected, who is the solution for, and who is it about, and involving that person throughout the process, and seeing how that actually allows for, increased adoption of solutions, allows for adoption, ownership. I know within healthcare, that's a very, very big key issue, that, you can come up with this really brilliant idea, but, because you've not been sensitive to understand the ecosystem that it will live in, who it's for, you've not involved them throughout the process, and you sort of just bring the solution to them. Often, more often than not, it just doesn't fit, or there'll be issues with acceptability or ownership, where the community or the people who you're seeking to serve, they're not interested. So I think also that's part of the other value with design thinking, that it not only fulfills the needs of the patients and their users, but it actually allows us to create solutions that will work, and that will actually be adopted within the systems that they should live.
Great, thank you for that. In the meantime, we have Joanita back online. Maybe she can continue with her case study that she was going to emphasize on.
Oh, okay. Thank you, Timo. So very quickly, the thing that I wanted to highlight about the beauty of design thinking in designing programs, be it programs or products or services for health is, for example, when we went into Bukedia, we had assumptions. We knew, we figured this is where medicines are with our solution. And being on ground, it's not validated, but we found so many new interesting things because what we knew about the medicine distribution chain in private healthcare and what we knew about that in public health centers as documented by the ministry was a little bit different on ground. From titles, you have medicine supervisor, something in literature, and then at the health centers, when you ask for the medicine supervisor, but we don't have that person anymore. Want to serve may not be at the dispensary unit, but it could be the store managers because there are people that control what comes in and what goes out at the health center. And then we found things like, while we were thinking about creating a mobile application, because we figured these are rural areas, most of the public health centers anyway are rural or peri-urban. We found that even when we create that application, one, we would have to consistently provide these people with internet if we hoped that they would be reporting at the same rate that they report on the paper stock cards. And then, of course, that evolved into understanding that maybe we needed a system that can allow them to feed information into this application offline and then simply reconnect to the internet as and when they can, afford it, or as and when they can find a place with affordable internet. For us, the discoveries were so many, but what that helped with is that when we piloted version 1 of Drug Dash in Bukedia, less than a month later, we had calls from people in Lamour because I think the biostatistician from Bukedia had attended a training with them, and they were calling us and just saying, these guys have said they have this tool that's helping them report better, and they don't have to input figures into spreadsheets anymore. Can you come and discuss this tool with us? So for us, it was so great, like what Abigail was just trying to what she just talked about, acceptability, ownership of these solutions when they are built with people that need them. They were going out and talking about what is it they're using, and even us getting into Lamour, we did not have to all these technocrats, their contacts, and trying to pitch this thing to them, because we had these foot soldiers who are enjoying using a tool that we had built with them and for them, talking about and telling other people how best they could take care of some of the challenges that they were experiencing in their own health facilities.
Great example. Thank you for that. I think what really resonates in all the three explanations that you guys gave is the importance of the user, putting the user central. How do you do such thing? Anybody would like to
You want me to go first?
Yeah, go for it, please. Take the stage.
Okay, thank you so much. So how do we do it? Now, for us, how we do it is engaging them as much as possible at most of the steps that we, development stages. Right from before that, so when we take up an innovator, someone comes to us and they say they want to work on an innovation. The first thing is writing a concept. We have a concept format that we use that has 5 sections, defining the problem, the solution, then the business part of it, because you're not developing it for charity. You have to make sure that this innovation makes money. So you have to tell us how it will make money, the partners, people you will be working with, institutions, and the team. Now, before the team starts writing, they will have to engage with the users. So if it's to work at the department, for example, I will use an example that I used at first on neonates. So who are these people that are directly in contact with these neonates? Mothers, nurses, doctors. Can you talk to them and figure out, gather as much information as possible? So we work with stakeholders, of course, depending on the problem. So like here at Mbarara University, we have the regional referral hospital. So we will send them to the neonatal ward, make all the arrangements to go and visit the ward, engage with some nurses, engage with mothers if that problem affects mothers as well, engage with some doctors at the ward and talk to them, gather as much insights as possible. Then from there, that's when we now start defining the problem. We sit down with this team and we try to help them define the problem based on what the information they have gathered. How does the problem affect the people? Who is affected directly? How does it affect them? What have they done? Because the first towards this problem, what are the solutions that they are having? Are they expensive? Why is it that the solutions they have right now are not working? And they are not solving the problem they intended to solve. The problem still exists. Then consult literature. Now we get into the reading and, gathering as much information as possible. Now from there, they will write a very good problem, define it, and then that's when we get into the solution. So as they are ideating, in our innovation lab, we have blackboards and we make sure that we have enough stick notes. I saw what you displayed when you were presenting. So the team will stand and start writing, what do you think the solution can look like? How do you think this solution can look like? So it's like a brainstorm. From brainstorming, they will now start coming up with prototypes. So all that is helping them define and come up with something that is user-centered. From there, of course, once they have a prototype, the first prototype, they will have to take it to the users again and ask them. It's just a simple design. They don't need to build something that is complete. They can use papers. They can use, if it's for example, an application, they don't need to do a lot of coding. They come up with something that is similar to what they think the solution will look like. Then they will have to go back to these people and ask them what they think, to gather some little user feedback before they can actually proceed to the real building of the prototype, the innovation. So once they gather that feedback, they will realize that what they have built actually, they need to make a lot of changes. So they will make changes and now start, and we get reviewers at several steps to look at what the teams are coming up with, and they also guide. But reviewers come in after this, the team has engaged with the users. They have gathered information, then the technical people will come in to advise and before the team can move on to the next stage. So from there, once they have the first prototype, of course, other stages, I will not talk about them, they will test. So the testing still, they go back, the second prototype, sorry, they will have to go back to the users, ask them, now we have developed this application. what do you think? They can do that if they want to publish by getting ethical approvals from REC and UNCST, or they can say, no, this we are not publishing. Let's just go back, have a simple tool that can help us gather information. And these steps are all iterative. They can go back when they gather this information at the testing stage. I mean, after testing, they will get more information. They can go back to defining the problem, redefine it and see what was missing and how they can do it. And then they can still ideate. Of course, they are making just a few changes and come up with another version of the prototype. So they do that repeatedly, but what they have to put in mind is the user. If there are clinical trials, they are doing these clinical trials with the users, because we emphasize that this solution is not for you as a team. This solution is for the user, not you. So you have to engage them at each step, at each stage, to make sure that what you're developing is not going to stay in the shelves, meaning that they are not going to buy it, they are not going to use it. So if you're developing as you're gathering information and feedback from them, you're sure they will take it up. Yeah.
Great. Thank you, Turinayo.
So that's how we do it. Yeah. And we have several innovations that we have developed that have all gone through such, these steps.
Yeah, so it's a really like a systematic approach to like getting on every step that you take, get the user on board. That's really nice. You're talking about engaging.
I missed that. I think. Shimo, can you say that again, please? I beg your pardon.
I just tried to summarize that what you say, and where you actually said is like it's a very systematic process with a lot of iteration, and along the way you're trying to get as much user engagement as possible, or a user involvement as possible. And one of the examples that you used is using interviews or interacting with people in the facilities that are not far from where you are based. Maybe Abigail, do you have any other like methodologies or ways to engage users in your design thinking processes?
Thank you for that, and also for that very elaborate description, Nuriat. I completely concur with all those different steps, and I think maybe for the people listening, it might sound a bit overwhelming, but to be honest, it's really a process that is at the heart of it. We're really seeking to understand the users and trying to get to a solution that actually fits their needs, and not being too comfortable with the first idea that comes to mind, but really being open to that iteration, open to failure, even when you take the solution to the users and they're basically, like, no, it's not working, and actually being open to the changes that you need to make. So I thank you, Nuriat, for sharing that elaborately, how the process works. I just wanted to add as well that, like, many times also from our experience as well, we've seen that sometimes also there's need for cultural sensitivity depending on that challenge that you're seeking to address. I'll give an example. We were working on a project that was specifically looking at how to improve access to family planning, so reproductive health services, and it was specifically trying to respond to the demographic health survey statistics of the country that really continue to show challenges within, access to contraceptives or use of different reproductive health services that are available at all the different healthcare centers. And of course, also part of the key issue for the project was to try and understand what's the decision-making process like for people? How does that vary, across the rural, urban, peri-urban? How does that vary, across the different situations, socioeconomic situations that different families are in? So like many of the health-based challenges, they're very complex and involve a lot of multiple stakeholders, multiple challenges to think through, and often, like to say, to answer your question, Timothy, I think it's to say that a lot of the times in trying to, you know, understand the problem from the perspective of the user, it's really choosing to spend time, you know, good time in the field right at the start of the project and even throughout the project. So especially critically right at the start of the process, where you're seeking to empathize and really get to the root. So I think maybe it's also to say that design thinking, you're not trying to just solve the surface, symptomatic, more visible to the eye problem, but you're trying to get to the root. Why is the challenge as it is? What are the causal factors that are causing this repeat cycle? And specifically for us with this particular project, we were trying to see, can we develop an assessment tool, a digital maybe assessment tool that can support different practitioners who are supporting various reproductive health programs in the different districts to be able to meet the needs of their target audiences much better, to be able to respond better to the needs in the field. And so we were able to, you know, at the start, you were trying to figure out how do we get to the solution of this. And, you know, in being in the field, we visited over, you know, I think 20 or so districts in Uganda, because we also really wanted to understand what it looks like from the different perspectives, you know, of course, like a country like ours, and, you know, very similar to a lot of the African nations as well. Each district you go to, the tribes, the language, the cultures, all of that varies, and how that also can really affect the way that you design a healthcare solution or a healthcare service is really critical. So one of the tools that we're using in that initial process was storytelling, which I know may sound a bit like, how does this even come in? But listening to stories and actually, in a way, to be able to empathize with people. Sometimes it's just actually being sensitive enough to sit down and hear them tell their stories, hear them share their pains, hear them, you know, describe experiences, describe their experience in as much detail as possible. And the role of you as the designer, as the design researcher in that case, is to really try as much as possible to observe body language, observe, you know, the details of the way that they narrate specific occurrences within their journey, within their experience, and begin to see how to document that throughout the process to then, you know, how do we get to what exactly is the root cause of the problem? So throughout our visits to over those 20 or so districts in the country, we collected a number of stories that were depicting people's experiences with family planning, with contraception. And all of these stories were so diverse, some of them extremely painful, you know, where you hear someone tell a story about being raped as a child and then married off to the person who raped them, and then having children and competing with co-wives to have more and more children, and then the issues of trying to find a male son, you know, because, you know, women maybe in that particular community are not considered, you know, to be of value to the family. So then you get into a competition with your co-wife to get more sons anyway. And then you begin to see how family planning is connected to so many other interrelated factors within a household that sometimes the solution, you know, for, you know, policymakers or for different program actors in this sphere, a lot of the times it's hard for you to fully empathize with some of these stories unless you're able to sit down and actually listen to them and think through how do you actually create a healthcare service that can meet the needs of a lady like this. So part of what we were doing was actually realizing also the value of creating spaces that allow for communities to engage together. So design thinking, I think it's also valuable to say that the approach in itself allows for people to have like some sort of peer-to-peer engagement, and in the process of you know, facilitating very core design processes with the communities, you're actually able to bring out, you know, bring out solutions in a community which already exist, which I would like to say that because many times as designers or as intervention developers or people who are sort of seeking to innovate, you sort of many times come into a system, assuming many things, you know, like was being said before. You come with your assumptions, and many times our assumptions are that there are no solutions that could already exist within the ecosystem. And so for us, it was actually of value to see, also to use tools that allow you to allow the community to sort of be together and be part of the co-design process, that then, you know, you're able to hear them describe certain solutions that exist. I remember in that, for that particular story that I shared, for us as the design team at that time, we were trying to think, okay, how would this digital solution actually even be of help to a situation like this? We were quite overwhelmed by the pains and the things that we were hearing. But then we later realized, you know what, the solution doesn't lie with us as such, but it's really more coming from the community. So we had designed a game. So using gamification to actually promote, you know, open dialogue and discourse over these very sensitive issues. So really being open to utilizing approaches like that. And so through gamification, people began to open up and disclose and talk about, you know, sex, a lot of things which, you know, within our cultures and societies, a lot of those terms, you know, certain things are not said. People are not supposed to talk about certain things, but, you know, utilizing tools, you know, from gamification and game design to actually enable that kind of open dialogue. We began to see people begin to bring out solutions that exist within the community. So for example, for that lady who I described, who was in some sort of battle with her co-wives, and having children wasn't really about being able to look after them, but really more about how will I survive in the future if I don't have sons who will then be able to, who will inherit the wealth of the family, and then who will actually, you know, secure my own livelihood. Within that same gamification, you know, the tool that we had managed to create, one of the people in the community said, oh, but, you know, there's this group that you could be a part of. They meet every week. You could actually get support here. You know, the women are learning a number of skills and this, you know. So in a sense, for us, it was valuable because in starting with creating one type of solution, if you're really keen to seek that the solution is actually adopted by the community and allows for people to be part of that innovation process, we then were really amazed to see that it's really from a place that you're not too you're not feeling like you're the expert, you have to be the one to give the solution, but allowing for the community to be part of the process. So really, in a nutshell, all I'm saying is that some of the tools that we've adopted is like from using things like storytelling, you know, gamification approaches to allow for you to get people to engage with you more deeply and get to the root of a problem, which maybe you wouldn't have been able to have people sharing as openly, you know, as you would have wanted them to if you were just sort of using other normal tools that, you know, someone will just, you know, in a questionnaire type of scenario, for example, you know, where you're just asking questions and expecting a person to answer. Sometimes, you know, you're not able to really get to the juice of it all, for lack of a better word to use. Yeah, so employing certain tools like that, you know, usually creates a bit of value, and trying to see how to get not just individuals, but getting the community involved. So there's a lot of co-creation as well that's utilized using design thinking, where you facilitate processes that allow different people in the community who are facing the challenge together to be able to dialogue together, to be able to sit together and see, you know what, this could work, this wouldn't work. Oh, we've tried this before. Oh no, that cannot work in our system. That is not appropriate. Anyway, so like really being able to utilize those kinds of design, co-creation sort of approaches is also, I think, of value in getting to the real root of the problem and designing a solution that fits.
Great, thank you for this very insightful answer. Jonita, are you still there? I don't see you at the moment, so I'm not sure if this is
Yes,
the case.
I am.
Oh, perfect.
I'm here.
I wanted to make the linkage between what Abigail just said in relationship to like getting the user on board. You were also like talking earlier about how you use design thinking also as a way to get governing bodies, governing stakeholders on board and get them involved and get them motivated to actually participate in that what you were implementing. Could you maybe elaborate a little bit on that and how design thinking helped you with that?
Okay, just I think 3 things. So taking it from what Abigail was talking about, her very last point, using all these other methods, these methods that work for people. I think one, I would like to emphasize that as we engage design thinking as problem solving methodology, we need to first of all meet people where they are at. So if you're talking about government policymakers or civil servants, I have seen conferences or whatever, consultative meetings where because there's a bit of money in the project, guys will like reach out to a couple of civil servants around the country and then like ship them to Kampala to come to I don't know, a hotel and do a consultative meeting. There's so many factors in that to this place. It's not home. It's not like they're living in their house, coming to your meeting. So even the state of mind that they are, the ways in which they will interact in places, even physical places that they're familiar with or not familiar with, will differ completely. So I think one, like meet people where they are, even as you find tools that work for them. If it's gamification of your process, of your survey process, do that. But even just thinking about not making yourself comfortable in this situation, continuing to center the user or whoever would be the client, find them where they're at. If government sometimes will say, people will say civil servants require a little facilitation to be a part of things. You might decide that we are not about this life. This is bribery, blah, blah, blah. And then insist that you're not going to do this. There's a high chance that you're not going to get people to participate. So if, especially for people in tech, we like to reduce documentation, physical documentation and copy type documentation a lot. But if civil servants want a presentation printed out for them to be comfortable in the meeting, you might want to just print that out, At the end of the day, what it is that you're trying to do is to reach people where they are, not where you want them to be, or where you imagine that they should be, and say whatever else that they're doing in their daily lives is a cake, so we are better off doing it this way. No, reach them where they are, because that could actually give you insights into solving a problem better, or simply getting whatever and might lead you down a wrong or very inconsistent path to your solving whatever problem it is. So understanding, like design thinking, and or innovator has to understand that health is a heavily researched and academic field, and so you come in with an aim of centering a user, but you might want to understand that certain systems that are kind of set in less agile ways, like working with government or policymakers, systems that may be a little slower to change than the way it is with the private sector or small entities. You've got to come in and with the understanding that health research based. So while you may want to engage your user and involve them, you might find that when you're presenting these findings, like for example, for us, the store managers are saying this and the other. You might want, when you're presenting those to, for example, government and research and policy analysts or makers, you might want to find language that doesn't say the thing we're finding on ground contradicts your research. Yeah, because that may not be something that is going to be welcomed or that's going to get you ahead or get things. Timo, I think we can proceed. I think I lost connection for a bit, but those are the 2 points that I wanted to put forward. Just understanding that you need to meet people where they're at, your users or your clients, and to remember that while you want to say that even when your findings are contradicting research, that you present that in a language that doesn't simply cause friction, but rather that maybe helps people appreciate that maybe some other generalized research might either be outdated now or the users might have outlived those situations. It's just something that needs to be at the back of your mind so that you know, like, this is where this sector is at, this is where this industry is at, and this is what I'm bringing to the table, and this is how best this group of people might receive these findings if you want to work with them. And a lot of the time you will have to work with them. So yeah.
Thank you for that add-on. I think it's really important to, of course, you can create something with the users, but it's a bigger ecosystem that you're a part of that you have to keep in mind. I want to go to 2 questions that were raised. So in the chat, there were 2 questions in regards to pricing. I asked Victoria to maybe even be able to ask the question personally. So maybe she can ask us the question herself. But I think it's a very important factor, right? Like how is pricing being taken into account? Because design thinking is about being bold. It's about being creative. It's about creating that what is maybe not even there yet, or improving that what you already have. But how does that relate to the costs that are potentially involved to that what you come up with? I don't see Victoria unmuting, so maybe having said that, Abigail, or
Hello.
Oh, yeah,
Hello.
there she is. Hi, Victoria. Thanks for
Hi.
joining.
Hi.
Would you
Thank you
be able to ask the question yourself in person?
No problem. I would. Thank you so much, the panelists and everybody who is in this discussion. Now, why I asked that question is based on my my 7 years of experience in supply chain working, where we have been forced to innovate simple, can I call them simple apps to help the health facility staff in making their work easy and keeping up with the technological world. The challenge comes in is when your bosses ask you, much as you've been doing these small innovations, because some of these innovations that we have done in health facilities have been picked up by some of the members of the government and Ministry of Health to take it up on the next level. But back in our mind, our bosses keep saying, well, where is the money? So you innovated that, where is the money for the company? Because you used the resources for the company to develop something like that. So that's why I posed that question. How can we, not that I'm against innovating in health, because it helps a lot, but how do you, at the end of the day, everybody becomes happy, let me put it that way, for the lack of a better word, of where I can help the health facilities. Me as Victoria, I'm willing to help the health facility without being paid, but how do I make my boss be happy that much as we developed this innovation to help the health facilities, at the end of the day, he gets whatever he wants to get? Thank you.
Thank you, Victoria, for elaborating on the question. So I think there are 2 aspects here, right? Like how can we justify the usage of design thinking in bringing a product forward? But on the other hand, how can we include maybe even profitability or putting revenue streams within the development of design thinking in the process? Abigail, maybe you can give it a first.
Thank you for that question, Victoria, and I think it's a really, really valid one. I'll maybe start by saying that I completely think that cost cannot only be thought about, after the solution has been developed. This is something that you do right from the beginning. So also important to note as well is that design thinking, yes, focuses on the user need. So trying to understand how the solution will actually fit the need, the context of the user. However, it also involves, a good analysis of the different stakeholders who are part of that ecosystem. So who is going to buy it? Who is going to, apart from a person who's using the solution, who's buying it, who is going to promote it, who is going to, distribute it if it's something for distribution. So really thinking through all the different stakeholders that are part of the solution, really right from when you're developing it. And really involving people like this right from the get-go is really critical and important. I remember a project we were working on with the Makerere University, Johns Hopkins University Research Collaboration, and a number of other actors. And we're trying to improve the immunization ecosystem by adopting an e-health system that had already been used in other countries, in Zambia, and so seeing that maybe immunization data management could be better in adopting this solution. It worked in other countries, let's adopt it here. And then sort of thinking through how the different districts, different districts would benefit from adopting this system. However, when you now talk about the money involved, part of the entire process is actually very early the design process to realize that system wouldn't work, because for one, at the district, there were already too many digital systems that the healthcare workers were already just like, we don't want any more, like leave us alone. We don't want more digital systems, more apps, we are tired. So first of all, the users, they didn't want it because also, sort of like Juanita was saying, because of the way that, even from a national level, innovations are adopted, like it's quite a process. So also understanding the process that it will take, you may be bringing in a solution that will maybe seek to take away a lot of these paper-based systems. However, the government requires you to submit those paper-based systems. So you might be giving me this e-system to improve my work, which is what we were trying to do. However, I still have to delete.
I think now we're missing Abigail, unfortunately. Nuryat, or would you maybe elaborate a little bit more on what Abigail was saying?
Okay, thank you so much. I think Abigail had elaborated a lot on that, but I can add on to what she has just mentioned. The sustainability bit of it. When we are working with innovators, we encourage them to come up with a sustainability model, the business part of it. And all that comes from the start. As you're empathizing, as you're trying to understand this group of people you're developing your solutions for, what are their capabilities? If it's an application that is working on an iPhone or on phones, smartphones, and you're developing it for rural mothers where there is no electricity, they cannot even afford a smartphone, they cannot afford internet, and you're developing an application that requires internet, it requires, it is working on an iPhone, on a smartphone. How sure are you that it's going to be taken up? So as they are developing these solutions, they have to put into consideration that sometimes, actually many times, innovators will get, there are so many innovation awards, money, grants, but after the grant, I said I sit on the Minister of ICT committee, NISIP committee. So, but we have to make sure as we are selecting these innovators, we will have to emphasize the issue of sustainability. After this money, what next? Are you going to keep on applying for more and more grants? Can this innovation sustain itself? It pays you as a team, but it also, like, it benefits the end user who is going to pay for this innovation or for this solution. So that is something that innovators have to think about right from the start. Otherwise, you will develop a solution that is not going to go anywhere. It will end in the shelves. Yeah.
Great. Abigail, you're screaming on the chat. How much are they willing to pay?
Yes, sorry. I was just adding to what Nuriat was saying. Sorry, I got cut off my connection, but I was just adding, you know, that it's really, yeah, how much are they willing to pay? Who's going to pay for it? And how much are they willing to pay? How much do they have at their disposal? You know, and also like the infrastructure question as well, you know, what do they have the infrastructure to actually adopt your solution? Do they have the technology? Do they have the training? Do they need training for it? Do they have the capacity within? So really that sustainability question is one that you can't think about at the end. It's part of the entire process right from the beginning. Yeah.
Yeah, great. So it's apart from the fact that we didn't talk about it earlier, it's a really important topic within the phase of the process of designing a new solution or new innovation or solving a problem. We are having a lot of people on the chat that are here that are potentially not even starting with design thinking, that never did design thinking before. Like, what is the first step to do? How do you start design thinking? Can you just start implementing this in your daily work? You have a problem laying on the table. Can I start design thinking this afternoon? How do you start such thing? Jonita, you have a lot of experience with students. Can you teach us how to do this?
Okay, Timo, just before I get to that question, it's something that Abigail touched on, but I wanted to emphasize I think it was, she wasn't called Victoria. I forgot her name. I think she's dropped off the call though. To say Victoria, actually, she is Victoria. That while it may be hard, especially to figure out, you know, who's who, how will they pay, if they will pay, when you're working with like public health systems, especially. It's not a dead end, and like Abigail and Nuriat said, if you start your needs finding, also considering these questions, like, you know, if they like this solution, how much are they willing to pay? How would they pay? You will find that you know, that there's actually people who are willing to pay for this. But the thing that I wanted to emphasize about that is that for an innovator, you have to understand that sometimes the user of your innovation or your solution may not be your customer or your client. Especially for healthcare, you find that there's so many players. There are, you know, implementing agencies for bigger world goals in health, people whose mandate literally is to meet certain goals, and your solution might literally feed into their results framework. You might find that those people are able to either help you start out the process of deployment, of piloting, while you also consider the question of sustainability. Does it go to the government? There are so many models, and I think it's something that Nuriat mentioned, although she was going over the entire process, that canvas that I think she was really talking about, the business model canvas. I think she mentioned that you know, while they talk about who are your partners, how are you going to implement this, what are you going to implement, what value, what channels are you going to use to deliver value, all those things on the business model canvas also feed into what your revenue streams are going to be. Sometimes it may not be that you keep deploying the system yourself. You could sell a system, you could maintain, you could just, you know, keep maintenance rights. You could do subscription models. because a lot of the time, especially when we work with low income areas or low resource areas, people start to think, those people are poor, you know, they live on a dollar a day, what could they possibly afford? But there are lots of health financing models, things like people using vouchers to access certain health services. You've got shared financing between, you know, end user or whoever is benefiting from the thing and maybe the facility. So you can find ways, but this is not something that you should do at the very end. So I just wanted to emphasize to Victoria that it's not a dead end. And if it's especially with public health care, it's not as if just because we are socialized to believe that people do not have money and there's no money in that system, doesn't mean that there's really no money. If people find value in using something, if you built it with them, you'll quickly figure out what they're willing to pay for this and who is willing to pay, who really is willing to pay. Just remember that your user may not be your client, and understand that in the start so that you can pursue the real client in the right way from the word go. Timo, you're wondering how do you even start design thinking? I think one, it's to first of all remember to not become like a slave to your tool. So design thinking, if you think about the steps of design thinking in the problem solving process, it almost seems automatic that anybody and everybody would follow this process in fixing whatever problem they identify, except that people are not doing it, and there's a reason why. So if you're thinking about where do I start, I think if a process has already begun, there's no reason crying over whatever spilled milk there is. You know, when you realize what resources you've already wasted, when you could have, if you had started off by speaking to clients, you could have saved yourself some nightmares. It's okay for that to have happened. You can start to use design thinking at any process, and this is why it's amazing, because it's a cyclical process. There is no one like start to end point for design thinking, because once you empathize with people, people's situations may keep changing. The people who you're solving problems for, they could keep changing and evolving, and you have to understand that even when you start a project in 2018 and you speak to clients at that time, they don't have electricity, it has not been extended to their place, so you work on a solution that allows them to access this without high power demands. You have to understand that in 2022, they might have already received electricity and it might actually be cheap, or they might be on a solar grid because Phoenix or MTN, I don't know who, has extended that power to them. So you have to continuously, you have to realize that even for somebody that started a project out with design thinking, they have to continuously review these stages. You have to continuously empathize with people. You have to continuously, keep defining or redefining your problem. Whatever problem you started with in 2018 might not be, or the problem may not look exactly like that in 2020 or 22. So for somebody that already started something, look at these steps and think, how do we, at what point do we get in touch with our users and other stakeholders and empathize with them and understand their processes, even as they're using what we have given them right now. Come back and look at those results or whatever you found from them and define or redefine the actual problem, because you might find that the solution you have out there, while people are not telling you, take it back, it might not be meeting their needs, their current needs today. So there's still room for you to redefine your problem. If you like, you can go ahead, if you're able to, you can go ahead and draw a prototype for whatever meets the new needs that you have found, and go back and test that with them. So you say this, we're hearing this and this from you. If we improve what you have right now and add this and the other or change this up, does it meet your current need better? And once you get that feedback, that's the testing phase. Once you've gotten that feedback, testing the prototype that you believe addresses the current need, come back and build better, keep checking with the customers. So I think starting, for me, starting out is start like where you are. If the project is new, start at the beginning. if the project is already underway, start right there. Like go and speak with your users and your clients and see really the thing that they have, the thing that you have built for them, the solutions that you have built, are they really meeting the needs today? Because they could be meeting needs of 2017 and like people have evolved right now, or even processes and policies have evolved and they're requiring better. And you have a chance to be the one to give them that better.
So really what you're saying is like really getting this user involvement as soon as possible on board, and then buy some Post-its, get some markers, and start the process of sharing and learning from each other. And ultimately, in design thinking words, emphasizing on that what's happening. Great. So I'm very conscious of the time. We have an outstanding question from Favor that is about how design thinking is keeping culture, ethical issues, sustainability, and evolutionary issues into account. But also, how do we make sure that the enterprise that you might be working is taking into account as well? And I would love to maybe give a very short answer, Nuryat, in response to that, and then take it from there. Like maybe not even more than 30, 40 seconds to get maybe to some additional questions if there are any. And then we can close it off with maybe some like fantastic statements that you can make in regards to design thinking. So Nuryat, the floor is yours, please.
Timo, I didn't get that question well. Can you say that again?
The question is how do you with design thinking, how do you address culture, ethical issues, sustainability, and even think about future and evolutionary issues that might be upcoming?
Yeah, thank you so much. I think it goes back to what we have already mentioned, engaging, because if it's culture, if it is something that this team you're developing for, this group of people you're developing for does not believe in, still you'll get the insights, you'll get that information as you're trying to engage them. They will let you know whether it will work or not, whether it will be acceptable or not. So I will still emphasize that with design thinking, it will help you get all the insights that you need for your solution to be accepted, for your solution to work, for your solution to solve the problem that it intends to solve. Since we have limited time, I don't want to go into the deep depth of giving examples, but we have talked about most of that. So engaging users at each stage will help you determine all that and make sure that you come up with something that would be acceptable and will work out for them.
Perfect. Thank you very much for that. Yeah, so we are rounding up this this call. Everybody was able to ask questions along the meeting. We didn't get any questions so far. We got some questions through the chat. Oh, sorry,
Timo, I just wanted to mention something. I thought we would hint on it, like challenges when you're trying to implement design thinking. It's a process that requires patience. Like I mentioned it when I was talking, I think I mentioned it, that innovators sometimes want to jump onto solutions. They are so excited about the solution they are bringing on board, but defining the problem comes first and should come first. And you cannot define the problem without understanding the people you're developing this solution for. So it is something that is important. You have to be patient with the process. If it needs going back, I also mentioned that it's an iterative process. You can go back to the other steps. After engaging innovators, after engaging the users, you can go back and improve on your prototype and test again and go back until you're sure that this is what will work out for them. You have gathered much information that has helped you to improve on the solution, and therefore it's what they want before you can finally deploy it. And I will end with a quote from Steve Jobs, say that designing is not just what it looks like and feels like. Design is how it works. And how it works is you get it from the users. So if you want it to work the better way, you have to engage the users as much as possible. Thank you so much.
Thank you, Nuriat, for this final statement from your angle. Abigail, do you have one sentence? We have only 1 or 2 minutes left. One sentence that you want people to take home.
Maybe I would say design thinking is really about failing fast, failing early, so that you can actually keep improving, keep growing, and actually be able to get to the heart of the problem and the heart of the solution. Yeah.
Thank you, Abigail. Joanita, floor is yours.
2 minutes is a long time to just say one sentence.
Actually, it's already over, to be honest. The time is ticking. 30 seconds to go.
Okay. So for me, outside of, the name or buzzwords, I think for everybody that's listening, I would just like them to take away the fact that this is a problem-solving approach. And as such, when you're starting to integrate it into existing structures or cultures or systems, you might run into problems, but that shouldn't stop you from going. Like, keep going and keep learning. Just remember that you're solving problems. So instead of getting frustrated with challenges that maybe the existing systems may present, remember that this is a problem-solving approach. So use it to solve whatever problems you're running into, and just understand that you're not a slave to your tools. Find what works and keep improving on your process. It's working for other people. Surely it should work for you, even when it doesn't work in the start or doesn't seem to work.
Great. Thank you for that last statement as well. So time is finished. I would really like to thank all of you for the time and the effort that you put into this discussion. It was very insightful. I hope some of the people that have been listening today will be buying some Post-its and markers to take it to the next level and be able to actually get those user needs and the information that they have integrated within their designing solutions to the issues that they come across in their daily work. So having said that, thanks a lot again, and I hope you have a great time. For the people listening, enjoy the rest of the Health Innovation Conference. Thanks for your time, and hope to see you soon. Feel free to connect on LinkedIn if any questions, at least in my personal LinkedIn if you want to. And as Abigail also raised, there's so much things out there on the internet, tools, methodologies, ways to get people's opinions on your desk. So just be curious and go out there and start design thinking yourself. Thanks so much and enjoy your day.
Thank you. Bye-bye.
Bye.
Thank you. Bye.
Bye.